Hello everyone. We have our guest from England, my colleague Satwant Singh. He is in the TAP 6th International Congress on Psychopharmacology in Antalya, Turkey. And we called him right after his course on CBT, and we would like to ask him some questions about hoarding disorder. As you know, it's a new diagnosis in DSM-5, and my colleague Satwant is one of the experts on this. So, hello Satwant, welcome to Antalya.
Thank you very much.
So, what will be the prevalence of hoarding disorder?
Okay. Now, currently the literature is not very clear in terms of hoarding disorder because it's not as known, a disorder that's very well known. In the published literature we have, it's between 1 to 3% prevalence, but I suspect it's much higher than that.
I think it's a condition people are embarrassed to talk
about, or also it's never been recognized. It's always seen as a condition, a symptom of another condition, maybe a subset of part of OCD, within the OCD spectrum, or obsessive compulsive personality disorder.
Yes.
Now that it's got a diagnosis in its own right, I think there'll be more research channeled into this area and we'll have a better understanding about this condition.
So how do we recognize this problem? How do we know someone has this or might have this?
Well, one of the things actually is when they present themselves to services is doing a detailed and thorough assessment to find out actually what are the current difficulties and such.
Okay.
And usually, in my experience, when patients have been referred, they're normally referred with depression or anxiety, and doing a thorough assessment, finding out what other further problems are, we tend to stumble upon a hoarding disorder. Rather than them actually saying they have a hoarding issue because they don't recognize it's a problem themselves.
Okay.
Yeah.
And it looks like these people are pretty happy with their hoarding. They don't want to, most of them or some of them at least, don't want to give it up, but so it can cause significant problems.
Yeah, because one of the things that, again, with hoarding is the attachment that people have to with their objects. So there's a lot of emotional attachment, a lot of instrumental attachment to those objects, and they appear to be happy with it, but it's actually the quality of life of the limitation within their living environment that actually aggrieves them quite a bit because they're not able to, the home is no longer functioning for what it's built for.
So they don't have any more space in their home.
No
they
space.
Can't invite relatives.
They can't invite relatives, they can't have friends over, they have no place to sleep or eat or cook.
Everyone is pulled up with something, some sort of object. So how do you engage these folks to get help and get some in therapy?
One of the things that we've done, I have been facilitating a treatment group since 2007 in London. It's a national treatment group for the whole of the UK, and that's the only treatment group that we've had so far. One of the things that we do when family members are requesting help for their relatives, what I suggest is, or what we tend to do, is getting them to watch some recorded material, DVDs on hoarding, which has got no connotation about labeling or stigma, and getting them to look at that and ask them, are there any similar features for them? And once they start saying, actually, I do that, or that, then we start having a dialogue and say, this is a problem, and then getting them to look at how is it impacting their life, what is different in their life compared to before they had the problem. Yeah.
I see. So they get the chance to see that on the video, DVD first, and they can make connections, and then they might notice their problem.
Yeah.
Maybe that will be something to motivate them.
And the other thing also, we have developed a tool, a very simple tool called with the HORD acronym. So H, what do you see in this picture? So what we tend to do with the HORD acronym, we get individuals to take photographs of their home, parts of their home, and then looking at the photographs in a neutral environment, and then answering this 5 questions in the HORD acronym, trying to explain what's happened here, what would you like to be different, how would you like things to be different, what are the steps, and how is it impacting your relationship. And quite surprisingly, being out of the environment and being quite detached from the objects, they see the situation as a problem. They actually come to realization it is impacting me quite a bit, rather than being in the environment. And that's a good way of engaging individuals into therapy.
So that's one way to take a few steps back and help them to see the big
That's
picture,
right. Yeah.
and then they can be motivated to get involved.
Yes.
So what would be the treatment options for hoarding disorder?
with the limited research that we have, that's been carried out in the last 20 years or so, it's always CBT based. And some of the work we've done within our group, some of the research we've carried out, it's based on CBT, and also a lot of experiential work that needs to be done. So I think there will be further developments in the area. The CBT work has got a place, but I think it needs to be expanded to cover other areas.
So I think there would be a lot of room for improvement, and also maybe using, as indicated, or testing psychopharmacological agents
Indeed.
in this field.
Well, there's been some studies done in terms of pharmacological agents, and they have not shown to be effective at the moment.
Right. So we'll see if there will be new ideas and
That's
new
right.
Pharmacological agents, but obviously CBT has been proven to be helpful, and I guess there needs to be more specialized maybe.
That's right. There's limitation of services, so there will be specialized work, but certainly being a diagnostic criteria in its own right, now it's got a diagnosis, what is in prompt or in push for more research in the area, and I think that's quite exciting.
Very good. That's an exciting information. Now, this is the first time I believe we have you here in Turkish Association for Psychopharmacology.
Indeed, yes.
And how your experience has been so far?
Actually, I must say it is such a slick conference. Everything is down to the T. Yesterday I had to start my workshop at 7 in the morning. Everything was up and running. I was a bit doubtful. At 7 o'clock, I'm not sure anyone's going to be here. 45 people turned up,
wow.
and the IT guys were here. Everything we had no hitches or problems at all, and everything has worked out quite well from registration to this point. There's not been a problem at all.
Well, I am very happy to hear that. Always there is some potential problems with the technology, as you know, but
yes.
I'm glad we were able to set it up, and I think it's exciting to see young people show up early at 7 a.m., 8 p.m. to almost 10 p.m. in the evening.
That's right.
Take your course.
Yeah.
And that obviously you are very well known and respected in your fields, but also they are very motivated to learn.
Indeed, and also what's quite nice to see is they have 900 attendees this year. I think that's such an amazing feat to have so many people and house and everything sorted out quite well actually. Yeah.
We are very pleased to have this many attendees. That has been becoming more and more international, a regional meeting every year.
Yes.
It will be from now on in April, so we are going to look forward to see you again next year.
I look forward to being here, and I thank you once again for inviting me.
You are very welcome. We enjoyed having you here, and so far it has been great. I get great feedback from the participants. They have learned very useful information, and obviously you cannot beat the wisdom and experience, so that's why we really want to see you in person.
Thank you.
Thank you very much. Thank you.